While we understand the critical issue here, it's a policy at BERT simply because we understand that the police need to do further investigation at the scene. So on the one hand, we cannot tie the ambulance up waiting at the scene, which may be a crime scene, waiting till the police is finished before we transfer. Secondary, we don't have enough ambulances to be able to deal with those. These are like what we would consider as well a non-emergency. And we would want the ambulance to be on standby, prepared to deal with those road traffic accidents and patients who are suffering from cardiac cases. These are the real cases that we need to deal with on a day-to-day basis. And so whenever we deal with those non-emergencies, unfortunately, because of a lack of resource, we are not able to provide all those services that we would want to.
So, when unless and until you get those resources, would it be best for the police or someone in the Ministry of Health, I guess, to provide vehicles that would be specifically used for those instances?
Yes, because there are secondary healthcare issues that you need to consider when you're transferring a patient, especially in an ambulance where it's required at that point in time for that ambulance to respond to another emergency thereafter, because the ambulance needs to be decarbonized, and a decarbonization process can take anywhere from 1 hour to 2 hours. And so once the ambulance is down for a decarbonization or a complete cleaning of the ambulance, that unit is down, and that ties up both the emergency medical technicians and that ambulance. So that's when the secondary ambulance kicks in, or the on-call ambulance comes in. When you add a situation like the pink eye outbreak, with multiple staff being out, then it presents a very risky situation for us at BERT.